Good morning. I'm Barbara Kasmin, Executive Vice President and COO at Newark Regional Business Partnership, and I'm delighted to welcome you all this morning to our Regional Economic Outlook. We had hoped we were going to be able to have this program live as we usually do, but unfortunately, we felt it was in the best interest of everyone to continue to offer our programs remotely. So we are here this morning with a great lineup of speakers. Before we get to the program itself, I want to talk a little bit about some of the things coming up at NRBP. We are continuing with our Diversity, Equity, and Inclusion series on October 28th. That program will focus on healthcare. We've felt it important, particularly in this climate, to spend time offering programming on diversity, equity, and inclusion. It's a continuation of our now 3-year-long effort to assist and to provide information, valuable information, with our members, many of whom don't have access to the resources to help them to build their teams and better understand how diversity, equity, and inclusion can really benefit the companies from all measures. I give credit to Maya Curry, our Communications Director, for leading our efforts in diversity, equity, and inclusion. And we will be offering some additional programs in addition to the trainings that we've offered. It's our hope that we'll be able to get back to the intercultural lunches that we were doing last year, as soon as we're able to come together again. So we're looking forward to that. Coming up this fall, our Transportation Awards will be on November 23rd. They will also be virtual. They were postponed from May. And that too, we thought we'd be able to hold them live. And now it looks like we will be in the best interest to hold them virtually. We're also working on an announcement for our combination of our holiday and gala that we had planned to have in March. And the honorees are Mayor Baraka and Barry Ostrowski, the CEO of RWJ Barnabas Health. So stay tuned for that. We don't have any networking programs scheduled, but we are planning to hold some additional networking programs. What we've been finding is that many people are really quite weary of being on Zoom so much. So we feel that we want to do some targeted networking, doing fewer and hopefully having more people participating. So watch for announcements on that too. Now to the format for today. I am going to introduce our series sponsor, the sponsor for the Real Estate Economics and Development series, in a moment. Scott Beresford will give you a welcome, and then I'm going to come back to introduce our economist. Scott, I will turn it to you. Scott, able to speak?
Barbara, hang on 1 second. I have to switch him over.
While Maya's doing that, I will also note that there'll be messages that will be posted in the chat box that you can refer to, and there's also a questions panel. One of the questions that comes up in just about every webinar that we have is, will the presentations be available? And the answer is yes. Do we have Scott? This has been
Scott,
a morning
you're
of technical difficulties.
Am I muted? Okay. Well, Barbara, thank you for that. It's been a little bit of an interesting morning so far, trying to get everybody ready to go. But thank you, Barbara, and to the staff of the NRBP for putting this together. It's my pleasure on behalf of TD Bank to show our continued support to the Newark Regional Business Partnership, its members, and all of those who also wanted to join. Today, we're sponsoring the virtual Regional Economic Outlook, so appropriately titled Uncharted Waters Economic Outlook 2021. So if anyone is not ready for this, I don't know what to tell you, but it should be a very interesting. TD Bank, just so those who don't know us, we are headquartered in New Jersey out of Cherry Hill. We have 239 stores in New Jersey, including 3 that serve the Newark market. We have approximately 8,000 employees in New Jersey, so we are committed to this market. Today, you'll be hearing from TD Bank's Central Market President, Martin Malilly, who will be the moderator. Thank you, Martin, for joining us. And for those who have any needs on the banking side, we are open and we're ready to support you. I could go on, but the message is TD Bank is available. We're here. We've been helping through the pandemic, and we will continue to serve everybody who needs our assistance. If anyone has any needs or would like to reach out to me and to talk to myself or any one of my associates, please let Barbara know or one of the staff members, and we would be happy to follow up to see how we can help you and your business. I hope everybody enjoys the program and presentations by Dr. Heil and Richard Kasmin. I've had the pleasure of hearing them in the past, and I cannot wait to hear the program and the panelists that follow. Barbara, thank you very much for allowing me to introduce TD Bank.
Thank you, Scott. TD, we're extremely grateful to TD Bank. They have been wonderful supporters of our efforts, and they have true community spirit. They do a lot of good work in Newark, so we're very grateful to TD, not only for what they do for NRBP, but also for what they do for the entire Newark community. Just one other note before I turn to our economists, and that is to say that we have been running this program for a long time, and we have been through various cycles. We went through 2008, and we went through other ups and downs over time. But I have to say that this is the time that is the most unpredictable. So I'm really looking forward to what the economists make of it. What I've heard said about economists is that they're historians rather than predictors. So it will be interesting to see what they think has happened so far during COVID, and what they think will happen coming up. So with that, I am going to turn to Dr. Alex Heil and Richard Kasmin for the economic presentations. And I'm going to be muted during their presentation and off camera. I'll come back on when they finish to introduce our panel moderator. Thank you.
Thank you very much, Barbara. Thank you very much to NRBP to giving me the opportunity to speak this morning. Let me just make sure that everybody can see my slides. What did I just do? Hold on. All right. Can you see my slides?
Not yet, Dr. Heil. Did you get the presenter box?
Yes, hold on. Oh, I have another thing that is coming. All right. Better?
Yes.
All right. Okay. It's always like, between the dozens of WebExes and team presentations and various things. So again, thank you very much. Without further delay, let me sort of jump right in. Some of you may have heard me speak before at the NRBP events, and in the past I've talked about what the probability is of recessions, and probably engaged in way too technical talk about yield curve inversion, capital spending, policy. Well, I may have at some point talked about a recession in the mid of 2020, but certainly nobody saw this coming, including myself. This is completely the pandemic, the way it materialized, is certainly completely unprecedented in recent times. And let me just make that point very clear. This is, at its core, a public health really an emergency and a crisis. And I think we've all seen this in the case numbers. Some of the data that you're looking at now is probably what you've also been closely monitoring. The data for the US on the left, essentially saying, we haven't really had a first and a second wave. We really had a step pattern. We had an initial step up in April, May, June, and then another step up. And now we're moving along at about 50,000 cases a day, which is incredible if you think about it. It's about 180 cases per million population. If you look at what happened in New Jersey, I don't have a map of New Jersey. I think Richard has much more detail on the state itself. But New Jersey, in terms of the caseload, is now 4 times what it was in mid-July. So we've worsened, and most of you probably have been working remotely and wearing masks, but the state still, because of reopening and just the colder weather coming in, people being more densified, seeing an increase in the caseload. And some of this is now spread across the country. So it's no longer just the East Coast, but now multiple states across the United States that see significant increases in cases. And the bottom line is, as long as this public health emergency carries on, it's going to be hard to see how the economy recovers. So what we have seen in economic output for the country is a collapse in economic activity in the second quarter of 2020. So that's not surprising, considering that was the period of the immediate lockdown, telling consumers that they can't leave the house and can't go into stores, telling businesses that they can't be open. So as a result of that, personal consumption dropped tremendously, especially for face-to-face interaction in particular services. So started with closing businesses, and it's only been in recent weeks and months that some of the reopening has occurred as well. So overall, just in terms of what the outlook is, let me just sprinkle in a couple of words on the outlook for the third quarter, which is going to be released at the end of October. I would expect the third quarter, GDP growth to be fairly positive, but I wouldn't take that as a sign of what economists sometimes refer to as a V-shaped recovery. I think we're pretty far away from a V-shaped recovery, and I'll talk about that in a second as well. But the data for the third quarter will likely be pretty positive, so it will be interesting to see how that shows up in the media. So I'm going to spend a little bit of time talking about some trends that are important. So one is, for instance, you can see the blue line, that's retail sales. And the collapse, as I was indicating before with GDP data, occurred in the second quarter of 2020. And then, it sort of bounced back. And some of this is bouncing back differently from what it was before. There's certainly a greater emphasis on online transactions rather than in-store transactions, but retail sales recovered in part because of fiscal stimulus. If you look at real disposable income, that spiked as a result of fiscal support put in place by the government that was, sort of at least retaining some spending and retaining some employment. Certainly didn't cure all the damage, far from it, but at least it shows up as a market spike in the data at that point. I think what we're now looking at is a protracted recovery, in particular when we're looking at the labor market. So this is all employment in the United States. You can see that going into the recession that started in February 2020, we had about 152 million jobs. We lost about 20 million over the period of March and April. And then indicated by the black dotted line, that's the bottom, the bottom of the trough here. You can see the blue line essentially has recovered now, half of what the decline has been. But as of September, most recent data point, we're still about almost 11 million jobs down from the peak of the business cycle in the early part of this year. There are two very concerning things that we're now noticing looking at the labor market. One is permanent unemployment is rising. It's no longer just temporary, people just waiting to go back to work, but now, what we're, sometimes referring to of separation in the labor market. There's been a lot of separation occurring between workers and employers, and as a result of that, people don't just have the option of going straight back to work. And just to make it clear, that's not due to people receiving a higher check in the form of unemployment benefits, which has since expired. This is clearly a case of businesses struggling, going out of business. Some of the statistics about how businesses are dissolving are pretty frightening and pretty significant. The second part that is very concerning is the inequities that are now materializing in the labor market. So just to give you an example, not shown in the graph, but if you look at the unemployment rate difference between white workers and black workers, that was about 2.5% going into the recession. That has now doubled. So the difference between those two groups of workers has doubled in terms of unemployment. So that tells you that some minority groups have had a much, much more difficult time becoming re-employed now that we're in sort of the recovery phase in this recession. So the decline was significant, and the recovery was about half of what we've seen so far of the decline that we had seen earlier. Structural changes are abound. They're everywhere. So one is certainly on the shopping side, on the purchaser side. So I isolated just some of the retail data. If you look at the increase in, e-commerce, think Amazon, right? It's Prime Day, I think someone told me right now. So if you look at the trend over time, it's been a tremendous jump in the second quarter of 2020 in retail purchases. A related in online retail purchases. And if you look at non-store retail, which is a slightly broader measure of this, then you're seeing that, that grew from about 34 to 40% as a percentage of total retail sales during the pandemic. So not surprisingly, and this is, I think, true for a lot of different sectors in the economy, what COVID-19 has done is has accelerated trends that already existed and that now are sort of you pushed 5 years, 10 years of change into a 3 or 6 month period, and we're certainly seeing that on the retail side. As if you're looking at the region, I will be talking a little bit about the region, and then with an emphasis on New York City, and Richard in the second part of our update is going to focus on the state of New Jersey. So some of you know I sort of engage in work that focuses on the Port Authority region, which is 18 counties. Whoa, what happened? 18 counties, 25-mile radius around the Statue of Liberty. And you can see the different sectors and how they have declined and then recovered since the first quarter of 2020. I indexed back everything to the first part of the year. You can see the big declines in arts, entertainment, recreation, accommodation, food services. Some of the face-to-face interactive businesses saw the biggest decline. I tried to indicate when the recovery to 100% employment would appear, and that occurs at different points. So certain sectors, for instance, arts and entertainment, right? Broadway's still closed. Nobody's making any plans to see Hamilton right now. By the way, if they're really dying to see Hamilton, you can show up at my house and my sons can perform. They've now since they've seen it on television, they've memorized all the songs. So you can take a seat socially distanced in my backyard. But all joking aside, I think a lot of these tourism services related sectors, they're going to have a very hard time coming back in the region. And that's what we're seeing if we'll just look at some of the data. In real estate, when it comes to the retail sector, average rents have been falling, more than 10% year over year. This is now for Manhattan, as reported by CNBC, that the per square foot lease rate is now below $700. That's the first time since 2011 that happened. And we're probably not at the end of this tremendous disruption that is occurring in real estate. And this is only for retail in that case. There's plenty of other changes that occur as well. I took liberty of taking some data and some graphical representations. Hold on. From my colleagues at New York City Planning, but I can assure you that some of these trends that you're seeing here are mirrored by Port Authority data. So if you look at the crossings from New York into New Jersey, you'll find similar patterns. So what have we seen during the pandemic? We've seen a collapse of transit ridership. I think New York City subway prior to COVID had about 5.5 million daily trips. Now they're celebrating 1.5 million. So they're about at 25%. That is roughly the same what you're seeing on all the other transit systems as well. And why is that the case? Well, people are no longer making trips for work purposes. People are working from home, and people perceiving transit as an unsafe alternative of travel, or a mode of travel rather. And so as a result of that, what we've actually seen is an increase in trips. This is East River bridges, the MTA bridges. But again, if you look at the Trans-Hudson crossings, you get a very, very similar pattern. There's been tremendous growth from the trough in terms of auto trips. But the composition and the nature of these auto trips is different than what we found before. So whereas before there was a large share of the trip portfolio there that were trips for work purposes, regular travel, people going in and out of the city for business purposes. Now, what we're seeing is that it's much more infrequent travel. So in total numbers, we have now replaced, the trips, and we're almost where we were before, still about 10% off, but it's the composition has changed. Now it's one-offs, driving children to maybe school, going to a doctor's appointment, making, visitation to other family members if that's possible. And we've seen a structural change that at least in the short term has occurred. If you need data to support this, you can look at parking information for Manhattan. We've seen a decline in monthly parking permits and an increase in daily parking permits or tickets that have been purchased. So it sort of backs up this whole story of more infrequent travel that has risen. And this is in part the mode shift that we're seeing from transit. Is this a new normal? That's an interesting question, because I think that once transit regains the perception of safety, once there is the perception that we will have we'll be over COVID as a pandemic, and there is either greater access to a therapeutic drug that is effective or to a vaccine, which the expert telling us, later this year, the middle of next year, it depends. They're certainly working very quickly to provide access, but this is not going to happen overnight. And in the meantime, I think there's a lot of workers that are now rethinking their both employment and residence decisions. I feel it's unlikely that the majority of folks are going to go back to the regular 5-day-a-week commute. I think it's much more likely that what we'll find is an acceleration of a pattern that probably already existed, getting away from 5-day long-distance commuting and maybe turning it into 3-day long-distance commuting with 2 days working from home. What does that mean for transportation? Well, it's significant. If everybody only commutes on 3 days rather than 5, then demand for transit drops by 40%. So in terms of what other data supports this, well, very few office workers have actually gone back to their office locations, and companies are now thinking about how to utilize other locations, how to reassess their real estate portfolio, and what this means for can you still see the slides? I have this thing popping up here.
Okay. Yes, we can see them.
All right, very good. So we've seen all kinds of coverage on the new normal. There's certainly, if you look at moving data, you can see how it's not necessarily the case that everybody is fleeing New York City or New Jersey for that matter, but there is certainly a trend of moves, especially during the pandemic, of people moving to less dense, less urban parts of the country. Vermont, Maine come to mind, where also the caseload for COVID was much less severe. But if you just follow what, for instance, was reported in the New York Times over the last few months, then this has been an interesting just observation of media reporting of this. So August 30th, and these are just 2 data points, right? It's just anecdotal 2 points of reporting. In the late August days, late days of summer, headlines were, the demand for suburban properties are out of this world. Everybody's fleeing. Last person, please turn off the light in New York City. Now, October 9th, slightly different story. New York real estate is on the mend. And so we are seeing maybe a rebalancing. I think if you talk to some of the real estate professionals, some of them might be attending this event as well. I think what they'll tell you is that there was pent-up demand because the market was essentially shut down for a couple of months. And this has really now bubbled up over the late summer, early fall days. And what we're also now seeing is certainly some change in preference and people seeking out more space because they figured that with you know, 3 boys living in a third floor walk up in Brooklyn, it's just not going to work under these conditions. So we're seeing some of that, but I would caution also these doomsday predictions that we're going to see the end of urban areas. I think we're going to see restructured urban areas and reused spaces and reused and repurposed real estate, but we're not all going to just abandon places like New York City. So what is the outlook before I hand it over to Richard? At the end of the day, this is a public health situation. And there are, in particular, there is, I feel very strongly about, what's happening with education, especially K through 12. As long as schools are closed in large, numbers, what we're finding is parents, don't have a choice but to work from home, even if they had an option to go into an office if they wanted to, or in a business meeting or some trip or whatever the purpose is. But there's the certainly a limiting factor is schools being homebound, and I can speak from experience, having 3 young sons that are all now struggling with a Chromebook at the same time. So you can extend that also and talk about, childcare, what this means for even younger kids, 0 to 3. The opportunity costs there are significant of not having adequate opportunities for them, and what that means for their working parents in most cases, and what kind of productivity losses are going and need to be mentioned even in non-COVID times. And lastly, higher education. Universities have certainly tried to be safe and try to have an environment in place where COVID can be managed. But what we're actually looking at is a lot of clusters of additional cases into the fall now that schools have reopened. And I think those are areas in which problems are likely to emerge once the winter comes. So what's the outlook? The outlook, in my view, from a national picture is that we're going to see relatively strong economic growth in the 3rd quarter. We're going to see relatively modest growth on the employment side. We're going to see a further fracturing of the recovery when it comes to different groups, especially minorities on the employment side, and lack of wage growth coming along with that. So some economists have started to call this a K-shaped recovery. I don't want to engage in sort of letters. There are too many letters already, and nobody really understands what the details of those are. But I do think that what COVID has done is has accelerated a 10-year trend into 6 months. And what we're seeing now is probably the need for much more targeted, direct policy, especially on the state and local level, because we are just at the beginning of what will be pretty fiscal, emergencies at many state and local levels that can probably not be addressed without federal help coming in. So I would think a slow, protracted recovery is likely to be in the cards here. And I think any kind of talk of V-shaped or quick bounce from the bottom is pretty premature and is not really backed up by the data. Richard is going to do a fabulous job talk about the states. I'm going to hand it over to him, and we're going to share these slides, and you can certainly look me up and engage with me directly also if you have any questions about my comments. Thank you.
Okay, thank you, Dr. Heil, for the introduction, and also many thanks to NRBP for having me. This is my first time at this event, and would have liked to have done it in person, but these are the times. And my presentation is called Coronanomics for New Jersey, and we're all experiencing coronanomics in one way or another. And coronanomics, a lot of it is about it's not all negatives. There's some positives in there. The positives have to do with the flexibility and the ability of people to adjust for things like this, and that's certainly been remarkable. So most of my slides are going to focus on New Jersey, but as an educator as well as a practicing economist, I never miss an opportunity to go back to Macro 101 and set the stage, which is what I've done with this slide. So if you remember back from your Macro 101 classes, there are demand curves and supply curves. And what we have in chrononomics is we have shifts in both demand and supply. The shift in demand is something that policymakers are used to dealing with. So if you think back to the 2008 recession, other recessions, there generally drops in demand. And the way that policymakers deal with those is through monetary policy and fiscal policy. So lowering interest rates, throwing lots of money at the problem, giving people money to spend. And certainly we've done that in spades this time. The feds have attacked the demand shift with PPP, with unemployment insurance, stimulus checks. Unfortunately, on the federal side, up to now, the follow-through has been weak. So there was a lot of money thrown at the problem. Since that fiscal package has started to wane, they've had trouble getting a new one through. I believe a lot of that is political, and we will get another fiscal policy package through, but probably after the election. So thus far, we are starting to see some signs of waning fiscal policy hitting demand. The problem in chrononomics is that we're not only dealing with a demand shift, but we're also dealing with a supply shift. So all these things about talking about businesses closing and the inability to get materials and goods shipped on time, to find new suppliers, all these things are a shift in supply. So what that means is that even if you can get a recovery in demand right now, it's hard to get a full recovery when you have gummed up supply. So that means that output will probably take a long time to recover to where it was before. So that has particular issues for the recovery. Shifting just to the focus on New Jersey. So what a hole we're in. So first off, on the left side, I have New Jersey private employment in thousands. So where we're at right now is 3.8 million jobs currently. That was as of August. At the peak before the coronavirus hit, we were at 4.2 million. So we're still at a level of employment that's about 10%, close to 10% of where it was before. That's a huge hole. We've recovered about half the losses in employment from the trough, but we still have a large way to go. GDP in the second quarter of New Jersey dropped at an annualized rate of 36%. So in lay terms, that would be about an 8 or 9% drop from the peak. It brings us back to GDP where we were in 2009. So it's a tremendous drop in the output of the economy. As Dr. Heil was saying, certainly the third quarter is going to see a big rebound. So we don't have that data yet for the state. In fact, we just recently got the state data for the second quarter, so it'll be quite a while. But these are just enormous holes that really, even going back to like the Depression, has no precedence in terms of just the pace of the drop. We basically froze the economy in the second quarter. And that's never happened before. So we're all looking at a very new type of backdrop for the economy. Just looking at the second quarter, not only which areas of the economy had the biggest hits, but which areas of the economy took the most out of GDP in the second quarter. So it might be a little bit surprising to know that actually healthcare and social assistance, given that this was a healthcare crisis, you'd think healthcare and social assistance would be relatively unscathed. But as it turns out, obviously a lot of healthcare offices had to shut down during the second quarter. And given the relative size of healthcare to New Jersey's economy, that took the biggest bite out of second quarter GDP. So out of the 36% annualized drop, that took about 5 to 6 percentage points off of that. So that was about a sixth of the drop. Wholesale, manufacturing, accommodation, food services, all also took bites out of GDP a little bit above 3 percentage points. Really hard to find an area of the economy in the second quarter that was unscathed. I think there might have been one in some area of finance, but otherwise all these areas took big bites out of GDP, as you would expect when, like I said, you know, the economy was basically just frozen in the second quarter. Nothing like that we've ever seen before. This table is a look at how the governor's budget was set for this fiscal year 2021 and what the new reality of the budget looks like in terms of revenues for 2021 and the difference between the two. So that first column, the GBM, that's the governor's budget message back in February. The governor's office was expecting gross income of about $18 billion. The new reality is of about $15 billion. So that's about a $3 billion difference. So if you go down the line, adding up gross income, sales and use tax, and corporate business taxes, we're looking at a difference in revenue projections of close to $5 billion, an 11% drop. So right now, at least for this fiscal year, the way we've dealt with that problem is to increase borrowing. So you've probably read the news, you've seen that there's $4.5 billion in new borrowing to fill that hole. So basically, at least for this year, it's a patch to keep the amount of government spending to be relatively stable to where it was in the first projection. So that's fine for this year. The big question will be two. One is, even with this, you know that there are areas of government spending due to social programs, different areas like unemployment insurance that were unexpected before, so they're going to be sapping some of those resources. The other question is, okay, we have this patch for this year, what about going forward? And why am I focusing on government spending, state government spending? Well, the reason is that this is a big area of New Jersey's economy and has a massive impact on the pace of recovery. This slide shows government employment as a share of total employment on the left here for New Jersey in different years, and on the right for the rest of the Northeast. So if you look back to 2008, New Jersey's employment, government employment as a share of total employment was about 16%, much higher than what we saw for the rest of the Northeast at about 15%. So I guess you could say in New Jersey, we were overinvested in our labor market in the government. So we had a lot of government employees. As the recovery took pace in New Jersey after the Great Recession of 2008, one of the big issues that kept New Jersey's economy from recovering as fast as some other states in the region was the fact that we were actually doing a lot of fiscal drag because we were laying off workers. We were reducing the size of our government workforce. And that actually even quickened into 2019. So we went from government as a share of total employment of 16% down to 14.5%. Now we're still a bit above the rest of the Northeast, but still a bit high, where the rest of the Northeast at last measure, at least before the recession that we're currently in, was at about 14%. So why am I emphasizing this? It's because one of the areas of fiscal policy that really matters for recovery is not just what happens on the federal side. It's also what happens on the state and local side. So we're coming into this with a big hole in our revenues that's been patched up to now by $4.5 billion in new borrowing. But we know some of that spending is going to go in ways to just keep people and businesses as well as we can through social programs and other things whole. You know that's going to sap resources from other areas. And one of the areas it's going to sap resources from is probably from public employment. So this will once again, I think, present a problem for New Jersey's recovery. Just the fact that there will probably be layoffs and furloughs of government employees. And that takes us to these two charts. So I always kind of think, if I could only have one or two or three different indicators, what would I want? So if a macroeconomist was stranded on a desert island, it could take only two economic indicators. The two indicators that I would want are initial claims for unemployment insurance and continuing claims. And what initial claims tells me about is what's going on with layoffs. So are layoffs rising, falling, steady? What's the level? And with continuing claims, it tells you for people who are already on unemployment insurance, are they moving off to get new jobs? And both indicators are sort of flashing red right now. So on the left, we have initial unemployment insurance claims, comparing this year in dark blue to the prior 2 years. At the worst of the recession of the coronavirus epidemic, we were at 21 times the level of claims that we were versus this time last year. Things really started to recover into August when we were only about 1.5 times. Now we're back up to 3 times. So things are deteriorating. And it's the same thing on the continuing claims side, where we saw a big recovery in the rate of the level of people who are on continuing claims, going from about 20% to about 10%, and it's stabilized there, and it's actually starting to rise a bit. So why do I think this is happening? I think one of the reasons is a lack of federal government support to the state, and the state having to lay off and furlough workers. Obviously, it's not the only reason, but it is, I think, a major reason why we're starting to see a rebound or deterioration in labor indicators. This gets to Dr. Heil's point about where we're seeing employment losses. It's not the same for everybody. This, instead of looking at it by race or ethnicity, is looking at it in terms of high, middle, and low wage jobs. Everything is pegged to right before coronavirus hit in January. So basically, for high wage jobs, we're seeing employment down about 4% versus that time. For middle wage jobs, about 6%, and for the lowest wage jobs, down more than 15%. So first off, just showing once again that this isn't the same for everybody, depends on what your wage is. But the other problem is that we're starting to see some deterioration, especially at the high wage jobs. So some of that's certainly government workers, but I also think this gets back to Dr. Heil's point, which is that we're now sort of in the second stage of this crisis, where we had all this money, this fiscal money that poured into the economy and helped stabilize things. But now we're getting into more like the behavioral changes. And part of that behavioral change is probably firms looking at their workforce and saying, do we need all these people? Are we going to be forced to restructure certain things? And so I do think that's happening a bit on the high end of the wage spectrum. Just quickly looking at supply issues. So one indicator we have of indicators on supply is the Census Small Business Pulse Survey. And it is indicating what I pointed to in the first chart, which is a supply shift in New Jersey. So this is asking small businesses about any issues they're having on the supply side. And certainly a lot of them are seeing supply issues. 25% of small businesses report domestic supplier delays slowing operations, and a whole litany of other reasons why there are slowdowns or difficulties in just getting supply. So that is the thing that's shifting the supply shift curve to the left and making any recovery, even if demand rebounds a lot, making it difficult. So I've gone through a lot of the negatives, but let's look at some of the positives. And this gets to the first point that I was making, was that there is a lot of evidence that there's resilience in this economy. Behavioral changes happen, people adjust. And one thing that's happening thus far that's really encouraging is that new business creation actually looks very strong, surprisingly. I'm not sure, I wouldn't hang my hat on it yet to say, well, I know that we're just going to continue to see a lot of business creation. But up to now, it's actually been surprisingly strong. So the blue line is cumulative applications for what we call high propensity applications. So this is an application to start a business where it's a high likelihood to have employees. And that level is actually now above levels cumulatively that we saw the last 2 years. So we're up about 6% at this point versus where we were at this time in the last 2 years. So a lot of business creation is a positive, great sign for things going forward. It does speak to a lot of resilience and people using this opportunity to go in new directions. So that's a great thing. Hopefully that'll continue. The other thing that's happening is we're seeing very solid growth in venture capital flows. So venture capital, as we all probably know, is the funneling of money into new or young businesses, high risk money. And in New Jersey, up through the second quarter, we've seen a big rise in venture capital flows. And not only that, but the share of capital flows coming to New Jersey as a share of the rest of the US is actually very high, rising, I should say. So these are all positives. In the end, I can just hang my hat back on what Dr. Heil was saying, which is that it's largely this whole recovery. It's all about epidemiology, information, and security. So as Dr. Heil was saying, we are seeing a rise, unfortunately, in COVID cases in New Jersey. Right now, we're seeing about, I think, close to 9 per 100,000 residents. Back in July, we were seeing somewhere closer to 3, so we're seeing a rise right now. But the recovery and the prospects for it are all based on a lot of things that none of us know. Will there be a second wave? Will there be a vaccine? What are the behavioral changes? And I also hang my hat on the great economist John Kenneth Galbraith's quote: "One of the greatest pieces of economic wisdom is to know what you do not know." And there is a tremendous amount that we do not know. So to listen to forecasts of economic recovery and how it's going to look and when it's going to come, to me is a bit foolish, because there's so much we don't know in this recovery. And that is the end of my presentation. Thank you for listening.
Great. Thank you to our two economists. I really, I think we can all take away a lot from that, and we'll turn to our panel in a moment. I just want to take a minute to thank our event sponsors today: Horizon Blue Cross Blue Shield of New Jersey, Structure Tone, New Jersey Economic Development Authority, PSE&G, and McElroy, Deutsch, Mulvaney, and Carpenter. We're very grateful to the event sponsors, and it's an important piece of support for NRBP. So if you're interested in some upcoming programs and next year, please contact me. I just want to make one note in introducing the panel. We are running a bit behind on time. So if everyone can stay with us, we'll go a little bit past the scheduled end time, 11:30, just to allow for a little bit more discussion. One of the points I just want to make, we didn't discuss previously, but I think is important, is that if you were to look at the proportion of women who are dropping out of the workforce, because just something has to give. And this is a real loss for really all businesses, because women are being the ones that are called upon for childcare and household duties to a greater extent than men. So it's my great pleasure to turn to our panel and our wonderful moderator, Nicole Alexander. When the panel finishes, Chip Halleck will come back to close the program. Nicole, it's all yours.
Thank you, Barbara, and thank you, Scott, and thank you, Alex and Richard, for your wonderful reports. One, I completely agree with Barbara, and I know it's something we're both on, Executive Women of New Jersey, a great organization, endeavor to try to get the vote out and also try to make sure we have great employment opportunities for our executive women out there. On a lighter scale, I will say I'm doing the best for the economy on the online retail side. It's been a source of therapy for me, so there you have it. I'm doing my best. So what I'll first do is introduce the panel, and then thereafter I'll ask each one of you to give a short, brief introduction in preparation for our discussion today. I will endeavor to do this, though, as a moderator. Unlike other moderators we have seen recently, I will try to stick to a plan, and I will allow no interruptions. So we'll figure this out and have a great spirited discussion. So without much further ado, please welcome Martin Malili, Market President for TD Bank. Hi, Martin. I like the drum set. Victor Viscomi, Director of Project Support for PSE&G. Bernel Hall, President and Chief Executive Officer for Invest Newark. Peter Kingstone, Dean of Montclair State University. And Alan Karp, Executive Vice President, Horizon Blue Cross Blue Shield of New Jersey. Welcome, guys. Let's start with Victor, because I understand, Victor, you have a slide to start with, and we can't see your face, but we can see your slide, hopefully.
Yes, thank you, and thank you for allowing me the opportunity to speak today. I apologize, my webcam is not working well with GoWebinar, And it's been the first time since mid-March that I put a jacket and a tie on. But anyway, what I wanted to highlight was PSE&G's recent agreement with the BPU for a 3-year energy efficiency program. It'll be spending $1 billion over 3 years through 10 energy efficiency programs. 5 of them will be for a residential customer. 5 of them will be for industrial and commercial customers. The residential customers, approximately 300 million of that, and the 700 million is for industrial and commercial customers. New Jersey ranks one of the lowest in the country in energy efficiency. The Clean Energy Act passed by our governor in May of 2018 was the driving force for us to put in our filing or in this area. Not only will it help customers decrease their bills, but it will also reduce pollution to the tune of 8 million metric tons, which is equivalent to approximately 1.7 million cars on the New Jersey road. It will create jobs, approximately 3,200 jobs. And of those 3,200 jobs, we have started a jobs program ourselves to help our vendors. The vendors will be the ones that will need these resources that will specifically be focused on low middle income unemployed residents of New Jersey. It will be paid for over a time period, which represents approximately 1% of the bill increase to all of our customers. However, those customers that participate in these programs could see significant savings. Part of our requirement that we will have with our vendors is that they'll need to specifically have targeted goals for hiring New Jersey residents, as I mentioned, and also hard established targets for minority women and veteran-owned businesses to be used. That's the highlight of the program, and I welcome any questions.
Thank you very much. I appreciate that. Bernel, do you have a introduction?
Good morning, everyone. Bernel Hall, President and CEO of Invest Newark, the City of Newark's Economic Development Corporation. I just want to start off by thanking the Newark Regional Business Partnership for having me today. Invest Newark is really focused on Newark's economic development, and in this case, recovery. We've led many efforts as it relates to small business assistance, as well as really sort of pushing businesses to e-commerce and more business-to-business contract opportunities with our anchor institutions. There's also our new investment fund and land bank that I'll discuss more during my time. But thank you for having me.
Thank you for joining us. Alan, I think you might be on mute.
Give me 1 second, Nicole. I'm trying to get him unmuted.
No worries. It's uncharted waters. That's what we're dealing with here.
Okay, I'm unmuted now, I think, Nicole,
Excellent.
Right? Okay, great. Sorry about that. So good morning. Thank you, Nicole and Barbara and the NRBP staff for asking me to participate on this panel. Horizon is located in Newark. We have over 6,000 employees throughout the state, with a significant percentage of those employees in Newark. And we're the oldest and largest payer in New Jersey. We have the pleasure of serving over 3.6 million members in the state of New Jersey. So I don't think anyone could have predicted what we've experienced in 2020. Not only have we faced unprecedented public health emergency, but political, social, and economic challenges as well. All of these issues have significantly impacted our economy here in New Jersey and across the country, across industries and employees in different ways. I could tell you that from a Horizon perspective, we've had about 97–98% of our employees working from home since March, and we figured out how to make that work, and we'll continue to do that until we feel it's a safe working environment for them to come back. So we play a significant role in the healthcare system. We've been in the middle of this pandemic from the start, trying to figure out how we're going to deal with it. It was very difficult at the start. We do have a lot more information now. But whether it's COVID testing and treatment, managing chronic conditions, dealing with medical emergencies for preventative care, we had to figure all that out throughout this pandemic. COVID-19 has reminded us that the economic growth and healthcare are undeniably linked. Accordingly, the McKinsey study that we've seen recently says that there could be between a 4 and 11% reduction in real GDP based on this pandemic. The other thing that this has brought to light is the disparities, racial disparities in healthcare, particularly in the urban areas, which we've been working on. I think you've all seen or heard the statistics about the people of color versus others who have contracted this disease because of density, because of multi-generational families, et cetera. So we're really focused on that. We have a number of members who are in urban areas and who are struggling with this disease. So we've seen the impacts of COVID on our customers. We have a lot of small businesses that we insure. We've done some things to try to help our members and our customers, our businesses. For example, we've waived copays and deductibles. We have deferred payments from small employers for 18 months. We've worked with the physician community, who, by the way, have been hit hard with this. This was mentioned by one of our speakers earlier. They only get paid if they see patients, and for a while when we were shut down, they were not seeing patients, and that had a significant impact. So we've worked with them to try to help them out. So those are some of the challenges we faced. I look forward to our discussion, and thank you very much for having me.
Thank you, Alan. And next up, Martin. And if we had more time, I would ask you to play the drums, but we're not going to go there right now.
Well, actually, I typically would play the drums for fun, and it was always that my whole life. But lately, I must admit, it's been out of frustration to let off a little bit of steam. So I'm ashamed to say that I've probably been playing more now than I have for the last several years. So there you have it. But Nicole, thanks very much, and thanks to everyone for having me today. Yeah, so I'm Martin Malilly, Market President of TD Bank. I've been in banking now for 31 years. I started off as a credit analyst and worked my way all the way up to as a bank president with a small bank, de novo bank. I'm now with TD Bank for about a little over 10 years, serving the central market of New Jersey. And I will tell you, I have never seen anything like this. All the different recessions we've been through, this feels and acts a lot differently than the others. And there's a lot of people out there trying to help each other, and I commend everyone on this panel, certainly for all the things that they're doing, and everyone that's attending this webinar today. I'm sure you're all doing what you can, and we are as well at TD Bank, and I'm sure we'll get into some of those details as the panel discussion goes on. But again, thank you for allowing me the time today. Appreciate it.
Thank you, Martin. How many economic outlooks have we done together thus far? Like 4 or 5, I think. Yeah,
I think at least, yeah.
Excellent. Well, last but not least, Peter.
Hi, thank you very much for having me. This is my first time with you folks, and I'm actually a relatively new transplant in New Jersey. This is only the start of my second year as the Dean of Humanities and Social Sciences at Montclair State. I'm a political scientist by training. I've spent 30 years or so teaching and writing about the relationship between politics and economics, and I was asked to be on this panel to offer some thoughts about this crazy election and what it means for the economy.
Well, on that note, I'm going to queue up a question for you, because this has been one of the most significant elections to affect the economy in history. What kind of factors are you seeing, and how do you think they're going to directly affect the economy one way or another?
Well, I'm glad you asked that, because historically, in fact, elections don't really have a lot of impact on the economy. We think that they do, but they don't actually. So as voters, we tend to give presidents way too much credit for good times and way too much blame for bad times. But this election is potentially very, very different, and it may have a significant impact on the economy. And I just want to highlight quickly three ways. One is that the two parties have been polarizing and moving farther apart for the past few decades. I don't think we've had a time in modern history where the Republicans and Democrats represent such widely divergent views of how to handle the economy. And certainly on the pandemic and on the economic challenges associated with the pandemic, Joe Biden and Donald Trump and the Democrats and Republicans are offering very, very different approaches to the two. And this is a case where those differences are really consequential. That's one. A second is that we have an unprecedented situation where we have a lot of uncertainty about whether or not we're going to have a winner as of November 4th. So I want to focus just really on one area, which is the dependence on mail-in ballots. We have a long, well-established and good history of mail-in ballots. There's a lot of talk about voter fraud. Voter fraud is not a real thing. It doesn't exist. It's a made-up thing for political purposes. So mail-in ballots have been very, very reliable and don't favor either party historically. But this time we have more issues. One is that we know that 40 to 50% of voters in using mail-in ballots. A lot of them are new voters and experienced voters and experienced with mail-in voting. And we're already seeing signs that the rejection rate of ballots is possibly 4 or 5 times higher than normal rates of rejection. A second is we actually have very explicit efforts to interfere with mail-in voting that run the range from just outright legal vote suppression to actual illegal things that are happening in California, for example, right now, where the Republican Party is under threat of violation of the law in putting up phony ballot drop-off boxes. So there's been a fair amount of litigation, there's been a fair amount of mischief making to try and actually hinder the process of mail-in voting. And the third is quite a large number of states, especially key battleground states, have extended deadlines for counting their ballots. So the first two issues mean that there may be a lot of votes for Joe Biden and Kamala Harris that are in question. And the third means that we may not actually have vote tallies until a week or so after the election. The result is that there's enormous potential for litigation, for all sorts of strategic and legal maneuvering to call into question the integrity of the vote, to try and put appointed delegates instead of elected delegates, et cetera, et cetera. Basically, the Constitution is actually very, very weak on what you do when you don't actually have a clear winner. And the possibility then for weeks of uncertainty about the election is considerable. And the last is very worrisome, is that about a quarter to a fifth of the American voting population does not believe this election is going to be fair. So on the one hand, we have Donald Trump and Vice President Pence, who are actively promoting the argument that the election is going to be stolen, encouraging conspiracies. There's been a huge uptake in social media in efforts to mobilize right-wing militias and conspiracies about the election, promoting the idea that there's a liberal coup going on, and inciting either implicitly or explicitly violence. And then on the Democratic side, there's a significant portion of voters who believe that the Republicans are trying to steal the election. The end result is that we're looking at a non-trivial possibility of violence associated with the election, either on voting day or afterwards. And I guess I just conclude that in the history of the world, there's no country that has had an economy prosper in conditions of violence, uncertainty, and a fundamental loss of trust in the basic institutions of government. So it's a tricky and worrisome election.
It's not great fodder for Thanksgiving talk at the dinner table, for sure. I think deeply entwined in that, Alan, has to do with containment of COVID. And I think it has become a political issue. But yes, as it goes as far as if the numbers stay stable versus the opposite, how is that going to directly affect your industry?
Yeah, thanks, Nicole. That's a really good question. So what we've seen is we've gone from a period in March and April where services were literally shut down in the healthcare delivery system, surgeries, physician office visits, et cetera, when our positivity rate was in the 20+% range. Emergency rooms were overflowing. Most of the patients that we're seeing in the hospital were COVID patients, which means that other patients who have chronic conditions were struggling, like cardiac cases or oncology. People weren't coming in, so that had an effect on the total health of the population in New Jersey. What we've seen recently, as the positivity rate has come down, the volume of services, particularly non-discretionary services like surgeries or office visits or even diagnostic testing, that's come back to about 85 to 90% of normal. However, as we mentioned earlier, as the positivity rate begins to creep up again, which we were under 1% back in the summer, we're now over 2%. If you listen to the experts, 3% and over, you start to get concerned again, particularly if the trend is going in the wrong direction. And I know that in the last month or so, we have seen an increase in COVID cases again. So what we recommend is obviously CDC guidelines, wearing masks. The statistics are that if 95% of the population wore a mask, we would have 45 to 50,000 less deaths than we do today. We're over 200,000, obviously, and climbing. Social distancing, et cetera. On the treatment side, things are getting a little bit better. I would say that the delivery system understands, first of all, how to diagnose the COVID cases earlier when people come in. When this first happened, there was no real protocol for dealing with these patients. However, the treatments are still in a I'd say experimental stage. There's some that have worked. What President Trump recently was able to get was a treatment that wasn't even approved by the FDA, even for emergency use purposes. So to think that anybody's going to have that ability to get that regimen of drugs for treatment is just not going to happen. They have used remdesivir, for example, in cases where people are on their last breath, unfortunately. So I think that if we can stabilize the spread of the disease, we can get back to a new normal. I would agree with what was said earlier that vaccines are probably, we're estimating second quarter before they're ready for distribution, because even if we get a vaccine by the end of the year, by the time you mobilize the delivery system to get that out to folks, it's going to take a while. Plus, consumer confidence in vaccines is not great right now, because no one wants to be the first one to take a vaccine that's just coming on the market because of the potential side effects. Eli Lilly just yesterday, unfortunately, had an issue with their vaccine development. So it's really, as we think about our business, the impact we think will be at least second quarter, maybe third quarter of 2021, as depressing as that sounds. But in the meantime, we're encouraging our members to follow the CDC guidelines as best as possible. The other thing we're looking at is a surge as we get into the winter months, as people move inside. That's another concern. So, but that's how we see that the disease progressing, and the impact on the economy obviously follows that.
Thank you, Alan. Wear your masks, everyone. I know there have been studies, absolutely. There have been published studies about the disparity of medical care being offered to minorities. There have been other studies about those businesses that have been really hit critically, including those Black-owned businesses. And I'd like to turn to our Harvard Business School grad, Bernel, to give us some insight as to what your organization is going to do or is trying to do.
Thank you, Nicole. As you mentioned, and as Dr. Hill and Richard mentioned, there has been a lot of magnification of inequities that already exist in our local and national economy among MWBEs, but it's even more pronounced now, given that there was already a huge wage gap, specifically in New Jersey. The household median income of the average Caucasian family is $309,000 compared to $7,000 for Latinx families, and just over $5,000 for African American families. And as Richard mentioned, the rate of unemployment is widening among the different demographics as well. And so what we really had to do is really, double our efforts. We've been back in office for quite a while, providing financial assistance to all small businesses, but with a specific focus on MWBE businesses, because what we've seen in the numbers is that these are those that are hit hardest because they tend to be concentrated in food service industries, arts, and entertainment, which are the ones, as Richard outlined, that have been hit the hardest by the impact of COVID-19. And we partner with several larger corporations, including Audible, in providing virtual management consulting services. We've also, obviously, via our partnership with the city, among others, United Way, that comes to mind, provided specific financial assistance via grants, as well as PPP loans in partnership with other banking partners. The total has been roughly $3 million in aid to roughly 423 businesses throughout the city of Newark since March. Under $7,000 per business. However, that bought many businesses a couple of months to really think about how they want to recalibrate, whether it's furloughing workers or laying off some workers to save the overall enterprise. Many businesses have been able to have had to face that choice. Other things that we're doing is really pushing our anchor institution to put procurement and contract opportunities on our Invest Newark procurement website to centralize business contracts for our small businesses to really earn their way out of some of the troubles that they're facing, versus just focusing on grants and other government aid that we know is very limited. So really trying to centralize where large businesses can opportunities for small businesses, while saving those small businesses marketing costs at a time when they cannot incur those costs. And then finally, the governor announced a $112 million stimulus package yesterday. Really thankful for that. We've been working very closely with EDA, among others, to make sure that these dollars are not spoken about kind of in the wind. One of the complaints that we get all the time from our small businesses, specifically those that are in some of these, food services, lower wage industries, is that they are not aware of these programs, and or the application process associated with these programs are arduous. So a lot of our work has been really simplifying their ability to get access to those dollars at a time when they need it the most. The other thing that we're really focused on in partnership and led by the mayor of Newark, Mayor Raz J. Baraka, is raising what we're calling the Newark Fam Fund. And basically the fund is really a private capital fund that will include banks looking to get CRA credit, as well as corporations looking to put foundation dollars to work, raising funds really to focus on African American and Latinx businesses that have some contractual opportunities but need some capital investment to put forth the infrastructure to build on those opportunities. Because what we find is with small businesses, especially in times like these, you don't really have to ask them to hire local or buy supplies locally. They do it automatically, and they honestly represent one of the best catalysts for recovery.
Thank you very much, Bernel. Absolutely. It's a little uplifting to hear that. I think the news of the governor's announcement yesterday was very well received. I apologize for the mood lighting in here. We're a little green in my office, so there's a sensor that goes off, and I'll have to whack it later to get some lighting. But I figure the green part of this discussion would be a nice segue to Victor's new program, and how, Victor, will this fabulous clean program provide more jobs to people that Bernel is talking about and elsewhere? Victor? We may have lost Victor. Give him a couple minutes.
He's still here. I think he's trying to unmute.
Okay, I'll try to put the light on then. Here we go.
Okay, thank you.
Wait.
I'm sorry, I apologize. Could you repeat the question really quickly?
Sure, I was just commenting or I guess complimenting Bernel and his organization's attempts at revitalizing the local economies. How has your Clean Energy Future program, what are the plans to do the same or provide local jobs?
Sure. Let me just start out by saying, if you take a look at PSE&G service territory, right, we service gas and electric service to every single urban center in New Jersey except for Atlantic City. So we've always had a commitment to the inner city. That has been renewed with this program. This program gave us the opportunity to, we knew we need to create about 3,200 jobs for our vendors to fulfill our objective. And we already had planned to focus on residents in the urban centers who are unemployed for those jobs. We actually started a year before this program was approved with the Department of Labor, getting ready to get folks ready for these jobs that were forthcoming. With them and our vendors, we have put plans in place to utilize a recruitment process through the state of New Jersey, Department of Labor. Our vendors have already committed to a number of these jobs and have a commitment that a great number of the jobs, as I noted, of the 3,200, 2,000 of those will come from this particular program that I speak of. With respect to minority, women, and veteran-owned businesses, our goal is by the first year of the programs that we will have 30% of those investments come through them. And by the third year, we're talking about 50%. So those are our commitments. If you look at it before COVID, this energy efficiency economy was struggling to get workers to begin with. And we looked at this as the opportunity to help our vendors get the resources they need in order to complete the work that's needed.
Wonderful. And I know it does. Thank you, Victor. And I note that Bernel has posted a link to investnewark.org to discuss the ideas and kind of go into further detail about what he raised earlier. I'm going to pivot a little bit, and I think that the word is completely overused, but I'm saying it anyway because that's what we're doing during this process. But to Martin, TD Bank was one of the biggest lenders of PPP loans in the state of New Jersey and number 5 or 6 in the country. Now's the time when people are going through the myriad of applications to ensure their forgiveness. How are you helping your clients during this challenging time?
Well, thanks, Nicole. First and foremost, I want to say how proud I am of my TD colleagues. We were able to pivot and create a PPP system and process in 3 days that would normally have taken us months, if not longer. Folks learned entirely new jobs. Hundreds of people, Maine to Florida, woke up on a Friday morning and basically had all new jobs. We all became processors and worked 14 plus hours a day. But we got it done. And, I'd like to say that we got it done in today's speed, not bank speed. We all know how bank speed can be not quite as fast as we would like it to be. We were able to help 85,000 customers with the PPP loans totaling $8.6 billion. And you're right, that made us #1 in New Jersey kind of by a long stretch. And we were 5, actually, I think we're #6 in the US, which is pretty good accomplishment considering that we're just an East Coast bank. But the thing is, the process allowed us to connect with a lot of our customers that we normally may not have had an opportunity to do that. Certainly it enabled us to have a better, more insightful conversations with those customers. And you're right, the challenge now is how do we help these 85,000 customers navigate the forgiveness channel? In short, we have hundreds of employees that are specifically dedicated to just this process. We just launched a series of tutorial videos that our customers can log into and to help them through the process. And we're certainly learning as we go, but we are available for one-on-one conversations with folks. We can't take a side of right, wrong type of a thing, whether you'll be forgiven or not be forgiven for with the particular PPP loan. So we tell folks to talk to their CPA and their attorney. But the bottom line is, you know, we do all say this, and we do mean this, though, in this particular case. We are in this together, and it is in all of our best interest to have our customers get these triple P loans forgiven. So as long as the money was used the way that the program was rolled out, so far, knock on wood, we've had tremendous success with the government in getting these things done.
Thank you very much. I know it's very much appreciated. I'm going to keep on you to talk about remote learning, and then I want to hear from all of you. But I will say, from the perspective of the legal industry, working remotely is something that we are encouraging most of our attorneys to do. You will note that I am in my office, and so I think we're kind of touching upon what Richard had mentioned before, kind of hybrid of working, whether you're going to be in the office a couple days a week, or whatever. So I'm in the office 2 days a week, but our hiring has changed. Our hiring has changed such that we've moved our on-campus recruiting to the fall, and that's probably going to be remotely. And then we're going to try to figure out and predict what our needs will be in a very unstable time. But then you have to really focus on some industries that I think are doing rather well. The silver linings in those industries, whether it's labor and employment needing advice and counsel for employers, or the bankruptcy industry trying to guide people to good resolutions, and even construction for that matter. I know Victor has a lot to say about construction, but I know, Martin, that TD has had a very strict policy about working remotely. What has that policy been like, and do we see that being how it is for the near future, or changing? I think it's going to change everything, so I'm kind of answering the question for you, but tell us from your perspective.
Yeah, well, everything you said is accurate. You know, look, there's no silver lining in the pandemic. We all had to learn to operate and function very differently. You know, if I was to say if there's a positive that can come out of this or something productive, I would say the one thing is that we have more time. You know, bankers, the commercial side of the bank for TD, we are 100% work from home. We are not allowed in the office. We have to actually get permission. I have to grant permission to folks to be able to go to the office, and it has to be timed to see how many people are there at that particular time. But again, maybe the silver lining to an extent for the commercial side of the bank is that we have more time on our hands. We're not commuting to the office, so we're having great and numerous conversations with our customers. On the branch side, a little bit of a different story. We like you, we kind of went to a 2-day work, 3-day off schedule for folks. A very limited skeleton crew all along through, you know, up until very recently. As a matter of fact, just this past Monday, we went back to 7 days a week. We had cut back our hours and our days up until this past Monday. And we created a virtual queue so that when a customer would come to the office, they would give their name and phone number and then kind of hang out outside or in their car, and they would get a phone call from or a text message from someone inside the branch to tell them to come in. And we limited the number of people in the branch to one person, one employee per one customer, and that was it. We are at this point in time, you know, that's kind of the schedule we're working with the stores, that the hours are there, but the very limited access to coming in as far as, again, making appointments and things. But on the commercial side, we don't have a time frame to go back to the office right now, quite honestly. We were officially told through the end of 2020 that we're not going in. But like I heard before, you know, with the vaccine and everything, the way it's going now, I will not be surprised to see us until June or sometime in the third quarter of next year.
Peter, I'm curious about your perspective from the university. Sorry, that's just
the $164 million question.
Yes.
We have it's a kind of complicated thing. You know, we have staff who tend to come from lower income communities and minority communities where the pandemic has been much worse, and who have to commute. and who are the least powerful people on a university campus. And we're asking a lot of them to come in. We're asking as many as possible to work remotely, but this is a very difficult, tense discussion. We have contingent faculty that all universities rely on, who again are very vulnerable, and these are very delicate conversations. And then we have tenured and tenure track faculty, or the only people who can kind of fold their arms and say, I really don't want to be here. And the large majority of them do not want to be working on campus and ask, why is it necessary? From the student perspective, there are, and again, a lot of the conversation has hinted at or talked directly about inequities. If you come from an upper middle class home, the likelihood that you have your own space and you have a good computer and you can work online and you have all sorts of networks of support around you are high. If you're a first generation student, as 40% of our students are, or you come from lower income communities, the likelihood that you are not thriving in an online environment, or the kinds of cultural capital and social capital that universities confer on new university students that they only get in person, that creates this really difficult tension. How do you balance the worries about safety, the worries about employees who don't want to work on campus, and the needs to actually provide a meaningful educational experience for students? So I think 95% of my job these days is negotiating that space, and I'm telling you honestly, it's a little tiring.
How challenging.
It's very challenging, and the stakes are high, and the emotions are very, very strong as a result of it. It depends, from my perspective as an administrator, it depends enormously on constant communication and transparency, and just trying to get people to move towards some kind of difficult equilibrium where there's really no ideal solution, and you're just trying to constantly balance. So it's very difficult.
I think you hit the nail on the head with respect to anxiety levels are high for everyone. And if you can, just be as transparent as possible and keep the communications going. And that's all we can do at this time. So I did make a promise to try to keep it short, and we're only a little bit over. So thank you, panelists, very much for your contributions. I have a feeling we probably could have talked for another hour and a half. Maybe we plan it for at the end of the day and we do cocktails. It could add a totally different element. I don't know. But thank you, Barbara. And I'm going to pass the baton to NRBP's president, Chip Halleck.
Thanks very much, Nicole. I think, I was looking at the numbers of people, and we held the audience for most of the last hour and a half. And as a credit to our speakers today, and for the way you presented the myriad of things that are going to affect our businesses going forward. So I have nothing but praise for everyone. And Alex and Richard starting us off with the facts, which are something we rarely get these days. So it's nice to have the facts that can help better prepare all of us going forward. And Nicole, thank you for doing a masterful job of working with the panel and moderating it and asking some terrific questions. And Bernel and Alan, Martin, Peter, and Victor, thank you for the insights that you share with us today. And I think that was really, that's really the purpose of this program, is to provide some insight so that all of you are better prepared to go about your business in the days and months ahead. So I hope you felt as though we accomplished that today. And I want to thank again our speakers as well as our sponsors. In a year like this, it's very challenging for NRBP as well. We're certainly appreciative of the sponsorships that are provided by companies that enable us to bring good information to our members. So thank you for doing that. We do hope that there's been talk during this program of the disparities that Black and brown people have felt during this pandemic and have been structurally coping with for many years. We do hope that our diversity, equity, and inclusion initiative will be of help to everybody to learn more about that. And on October 28th, looking at healthcare disparities is our next installment. We hope you'll join us for that program. So be informed, be active with NRBP, be safe. And this is not a political statement. Mask up. So thank you all very much. Have a great day. We look forward to seeing you all again soon. Thank you.
Thank you.